Hello everybody, this is Dr. Mehtab. Welcome back to my channel Preventive and Social Medicine. Uh, I'm a first year resident in Community Medicine Department. In the previous video, we have discussed about isolation guidelines and case definitions of monkeypox disease. In this video, we will discuss about the surveillance, contact tracing and vaccines effective against monkeypox virus. So, to identify the cases, we have to do surveillance. So, routine surveillance is IDSR, Integrated Disease Surveillance and Response. IDSR is a strategy adopted by countries in WHO African region for implementing comprehensive public health surveillance and response system for priority disease condition and event at all levels of health system. So, under IDSR, we will do indicator-based surveillance, which involves reports of specific disease from healthcare providers to public health officials. Such information is described as structured information as it is standardized. Then, event-based surveillance. Event-based surveillance are organized and rapid capture of information. It looks at reports, stories, rumors, and other information about health events that could be a serious risk to public health. Then we have to develop the standard case definitions. We have discussed about them earlier. Then if an outbreak occurs, then we have to enhance the surveillance. So enhanced surveillance is collection of data above that collected for routine surveillance, generally at a patient level and often to design or evaluate an intervention or to aid control of more important health hazards. So in this, we have to do intensified reporting and monitoring. So any loopholes in the definition, case definition should be corrected, updated case definition, then active case finding. In India, the surveillance strategy aim is for rapid identification of cases and clusters, infections, and source of infections in order to isolate the cases to prevent further transmission, provide optimal clinical care, identify and manage contacts, protect frontline health workers, then effective control and preventive measures based on the identified routes of transmission. So these are the aims of surveillance strategies. So surveillance outline. Standard case definitions to be used by all district surveillance units under integrated disease surveillance program at point of entry. So detailed investigation of outbreak to be carried out by the rapid response team initiated through IDSP. So any positive case to be reported immediately to district surveillance unit or state surveillance unit and central surveillance unit, which shall report the same to Directorate General Health Services, Ministry of Health and Family Welfare. So the samples to be sent to the designated laboratories as per guidelines. Then hospital-based surveillance is, we will find out the cases in health facility-based surveillance and testing in dermatology clinics, STD clinics, medicine, pediatric OPDs. So this is health facility based. So targeted surveillance can be achieved by measles surveillance by immunization division, targeted intervention sites identified by NACO for men who do sex with men, so female sex workers population. Then we will discuss about contact tracing. What is whom you will consider as a contact? So definition is a contact is identified as a person who in the period beginning with the onset of SARS cases, first symptoms and ending when all the scabs have fallen off has had one or more of the following exposure with a probable or confirmed case of monkeypox. So the contact can be face-to-face exposure, including healthcare worker without PPE, direct physical contact, including sexual contact, contact with contaminated materials such as clothing or bedding. So these people are considered as contacts. So we have to trace them, like we have done in COVID also. So identify the contacts across household, workplace, school or nursery or healthcare facilities. So sexual contact, transportation, places of worship, sports, social gatherings, and any other recalled interactions. So contacts should be monitored daily for 21 days for signs and symptoms from the last day of contact with a patient or contaminated material. Asymptomatic contact should not donate blood, cell, cells, tissue, organ, or semen while they are under surveillance. So, asymptomatic healthcare worker can continue their duty and should be under surveillance for symptoms. So, risk communication. Risk communication is a central strategy for managing monkeypox. Purpose is enable the people to protect themselves and their families. So we can do the risk communication through social media, print media, mass communication, interpersonal communication, leaflets, posters, fact sheets, daily situation reports. So rising awareness of monkeypox. Avoid contact with wild animals, especially those found sick or dead. So wash hands frequently with soap and water, especially after caring for or visiting sick people. Do not share bedding, clothing, towels, or utensils with sick people. So thoroughly cook all foods containing animal meat or parts properly before eating. Use personal protective equipment when caring for patients. So avoid unprotected close contact with infected people. Isolate infected patients in hospital or at home. So community engagement. First, we have risk communication is we have already informed the community. So community engagement can suggest communication channels, contact hard to reach populations, provide information on cultural beliefs and practices, dispel rumors and misinformation. So safe and dignified burial. These protocols were followed in COVID management also, COVID death cases. So basic rules for safe burials. Dialogue with the community, adapt local practices, select and train burial team, do not touch the body, wear protective equipment, wash hands after burial, disinfect the homes and health units. So advisory for international passengers released by Indian government. So travelers should avoid close contact with sick people, including those with skin or genital lesions. Contact with wild animals such as rodents and non-human primates. Eating or preparing meat from wild game or using products derived from wild animals from Africa. So contact with contaminated material used by sick people that came in contact with infected animals. So these are the guidelines issued by Indian government for the travelers. So consult with the nearest health facility if you develop symptoms suggestive of monkeypox like fever with rash. If you are in an area where monkeypox has been reported, you had a contact with a person that might have had monkeypox. So role of airport health authorities or port health authorities like remain in a state of alert for passenger arriving from the countries reporting monkeypox outbreak. So familiarize with clinical presentation of monkeypox. Undertake strict dermal screening and travel history of last 21 days. So establish a strengthened referral system with from airport or port to the link hospital. So inform concerned airlines about detection of a suspected case for the purpose of disinfection as per standard guidelines. So vaccines. Vaccination with smallpox or monkeypox vaccine can protect the laboratory personnel working with other pox viruses. So vaccine approved for monkeypox on November 24, 2019 by US FDA. So field studies are needed to support wider use. They're basically given to the people who are at more risk of infection. So a new vaccine developed live attenuated non-replicating vaccine, Jynneos. The strain used is modified vaccinia, Ankara, Bavarian, Nordic. So it is given to adults above 18 years. So below 18 years, it is not given. And for elder people also, we have to give only to those at high risk of getting infection. So 2 doses of 0.5 ml administered subcutaneously 4 weeks apart. So booster dose is given for every 2 or 10 years for those at high risk. So mechanism of action of monkeypox vaccine is it elicits a cellular and humoral response against other pox viruses. So these are the vaccines now. For treatment, antivirals like cidofovir and brincidofovir. Mechanism of action of these drugs is they inhibit the viral DNA polymerase. So replication will not occur. Then tecovirimat ST246. It inhibits the viral envelope protein P37 and block the release of virus particles from the infected cells. So research is being carried out on effectiveness of vaccinia immunoglobulin against monkeypox virus. It is approved as a treatment in America, but still the research is going on. So finally, we have discussed all about the epidemiology, response and surveillance of monkeypox disease. Thank you.